The main muscles of the shoulder are pectoralis major and minor, teres minor and major, subclavis muscle, and the rhomboid major muscle. The motions in the glenohumeral are abduction, when the humerus is elevated on the glenoid in the frontal plane; flexion, when the humerus on the glenoid in the frontal plane moves upward and/or forward; extension, upward movement of the humerus on the glenoid in the sagittus plane towards the rear of the body; internal rotation, rotating the humerus on the glenoid in a medial direction; external rotation, rotating the humerus on the glenoid in a lateral direction; scapular plane abduction, elevation of the humerus on the glenoid in the scapular plane, which is midway between the coronal and the sagittal planes; horizontal adduction, movement of the humerus on the glenoid in a medial direction, usually accompanied with some degree of shoulder flexion. The scapulothoracic motions are upward rotation, which is one of the primary motions that turns glenoid upward and moving inferior angle superlaterally away from the spinal column; downward rotation, the other primary motion that returns the joint toward the spinal column; protraction, scapula moves laterally away from the spinal column; retraction, scapula moves medially towards spinal column; elevation, upward or superior movement, like shrugging your shoulders; depression, downward or inferior movement, as in returning to normal position. Phase 1. Wind-up. Barely any force is used. Rotator cuff muscles are inactive during the stage. No common injuries occur. Phase 2. Early cocking. Primary muscles used are the deltoid. No common injuries occur. Phase 3. Late cocking. High torque phase with maximal shoulder external rotation. Primary muscles used are teres minor, infraspinatus, supraspinatus. Common injuries that occur are internal impingement and glenohumeral defect. Phase 4. Acceleration. Rotates ball to release point. Primary muscles that are used is triceps, pectoralis major, latissimus dorsi, serratus anterior. Common injuries that occur is overuse of the rotator cuff.
Go.
Phase 5. Deceleration.
Go.
Gravity moves over foot to even it out. All muscles are required to slow it down. Common injuries that occur is slap lesion, biceps tendon injury, brachialis injury, and teres major injury. Phase 6. Follow through. Body rebalances and stops forward motion. All muscles return to normal resting levels. Common injuries that most occur is when repetitive stress is in place. Bankart lesions happen when repeated anterior shoulder subluxations occur. Signs and symptoms of this are pain when reaching overhead, instability, weakness, and limited range of motion. To repair this, surgery is needed unless it's a minor case. To prevent Bankart lesions, you should stretch before using shoulder excessively and wear a brace. Anterior dislocation of glenohumeral joint happens when extreme rotation of your shoulder joint pops the ball of your upper arm bone out of your shoulder socket. Signs and symptoms of this are extreme pain. You can see the shoulder popped out and swelling and bruising occur. To treat this, medicine is given to help relax the muscles so a medical professional can pop the joint back into place. Then a sling should be worn for at least 3 weeks. Medication can help reduce swelling. To prevent this from occurring, you can wear a brace and stretch your arm daily.